Hi, this is Dr. Arun More, clinical cardiologist and founder of MH Clinic, the Mobile Hypertension Clinic, and Rural Health Progress Trust. That NGO we are working for hypertension, diabetes management of population at individual and population level. So this is just a small brief that what this project is about and how we are going to go ahead with your association into the project. This project is basically for capacity building, and it will be running through 1 year in the urban health centers associated with our medical college. And you, the medical interns, will be the treating hypertension specialist and diabetologist for the population. So basically we will be integrating the technology into this, and we will be handing over the technology for you, which is based on some of the artificial intelligence and algorithmic predictions, and that will support you that how should be the individual treatment of the patient should be. Now, why this project carries a huge importance? It carries a importance as far as academics is concerned. We are going to generate an evidence for the world that how the medical interns or the manpower who is eligible to prescribe the medications and diagnose and treat the hypertension and diabetes like diseases which have huge prevalence and incidence among population, and that is leading to many fatalities all over the world, and a whole of the world is actually suffering, facing this problem for having trained healthcare manpower or the doctors to treat these diseases. So through this project actually we will be generating a very good evidence where every doctor can be utilized into treating hypertension and diabetes, where we can save millions of lives. So this is one aspect of the project outcomes which may be seeing we will be seeing after a year. Second outcome obviously providing the access to check the blood pressure, access to get it treated, check blood sugars and get it treated at very economical level. So basically in Latur, what we are planning to achieve is that particular area will be benefiting with our project to spend as much as less economy or money and get their blood pressure and sugar treated in a standard way. Now, how the technology will be integrated into this? The MH Clinic, the Mobile Hypertension Clinic app. So slowly I'll be introducing the app to you all guys actually. So this app will support you for prescribing the medications, deciding the management and treatment of the patients, about and then individualistic approach for that particular patient for hypertension and diabetes management. One of the problem with all of us is that we don't treat the blood pressure or diabetes of our own parents, even parents as well. So the app within technology will help you out, support you out to take a decision that which medication needs to be given, or at what point of time the medication needs to be increased, or any another molecule needs to be added, and what are the points where the patient should have compliance for all the things what you are advising to the patients. Compliance is not only about the medications, but the compliance is also mandatory for their physical exercise, their salt reduction. Now, as we are integrating the technology over here, we have other stakeholders into the system which will help you out to control blood pressure and sugar of you. I'll be explaining completely about the project in very soon when we'll have the on-ground training sessions. But this is just a brief to get an idea what we are going to deal with under this project. The technology is being developed in such a way that these particular patients, if they are consulting you for suppose one of you for initial 2 months, and some other intern replaces you after a brief period, then those patients will be transferred to the other intern, other doctor, and basically the technology will help out n number of doctors to treat the same patient with the same protocols and guidelines. And believe me, doctors, this will be a very huge academic feast for all of you for the coming days, because we will be discussing a lot on hypertension and diabetes. We will be discussing on guidelines, protocols. We will be having case studies to be discussed. We will be having journal reading probably once in a week or once in 2 weeks. So this will give you insight that what is research and how research should be done, how research should be carried out. So as I was telling you, this will not be only a project, but it will be a very good opportunity for all of you and for us to understand the scientific aspects of the community project, how we are going to deal with the huge problem of hypertension and diabetes. And let me announce one more thing. Actually, all the interns, all the doctors getting involved in this project would be getting certificates for being part of this research. And those doctors, those interns who do really good, and those who are interested to carry on with the project for its time limit, their names also can be involved in the publications. So this is very good academic feast, very good practical feast, and let us come together and let's start the dream, actually, what we with which we have become doctors, to treat the patients and give our services to them right from day one of your passing out from MBBS and your undergraduate courses. So this is a little bit brief of the project, and I welcome you all of you into the project, and I expect good support from all of you to treat the patients with hypertension and diabetes, and let us exchange knowledge among us, and have some research papers by the time you go into your pages. Thank you so much, and very soon we'll see to the on-ground training sessions. Thank you.